And good morning, everyone. This is Coffee with Dr. Munné. Thank you so much, you guys, for tuning in. For those who are catching up during the day, during the week, just want to let you know that we are running this Gum Grafting Series with Dr. Munné. We're going to have the opportunity to have her every Friday so she can answer all your questions.
Yes, thank you so much. Gum grafting is probably one of the areas of periodontics that's been more overlooked, and I think that it's going to be important to educate the community and to give you all the information to know, well, is this something that I should pay attention? Do I have it? If you know you have it, what should I do? Do I need to treat it? Do I need to see a specialist? So I'm going to try to address those questions. And of course, just to keep the time manageable, we're not going to go over everything today. So stay tuned because we're going to continue talking more on the upcoming weeks about gum grafting. So, what is gum grafting? Gum grafting is a technique where we're actually, like the name says, grafting means adding, and gum was we're adding gum. When do we do that? We do that when there's gum recession. So the gums are receding, and that means that the teeth look longer and we start seeing the roots. So the roots get exposed. Now, how come the roots get exposed? Because we know that the roots are inside the bone, right? So we do have the root that's inside a bone socket, and that's covered by the gum. So when the gum exposes the root, that indicates that the bone has also, receded. So the main reason why we want to treat gum recession is because when the gums recede, they recede with the bone. So it's not only a cosmetic issue, which is not really the reason why we want to treat it, is also a support issue. So because of that, I think that we have to be very mindful every time that we lose bone, that we need to take precautions to make sure that those things do not happen again, and that we don't continue having that and maybe lose the tooth. So this is a possible cause of tooth loss. So that would be the main reason to address it. Now, when as a specialist, when I'm looking at a patient with gum recession, I'm looking not only at the amount, in height of receding gum, of root exposed, but I'm also going to look at the width of the gum, how thick the gum tissue is. And in general, most patients that have gum recession, they usually have very thin gum tissue. And that's just something genetics. It's like, why do I have thin gums? Is something I did? Do I brush too hard?
Yes.
Why do I have it? Well, it's genetics. So, it's like having blue eyes or thin hair. It's just our genetic makeup. So we have thin gums. And obviously, patients with thin gums are the ones that we see often commonly in the periodontal office because they're the ones that have most commonly the recession. Now, gum recession is usually a result of a combination of factors. So usually this doesn't happen only because one reason. It happens because A, B, C, and D, pile together, and then that causes the recession. So what would be some of those causes? So we're talking about thin gums. So when a patient brushes aggressively, they have thin gums, they're gonna cause the gums
Oh,
to
wow.
recede. Certain techniques, the pressure, the brush. There's a lot that we can discuss about that, but I'm gonna just go quickly today. Another possible reason is also, the fact that the patient might have some braces. So the braces can sometimes the movement, if the patient has also thin gums, can cause recession. The fact that maybe the position of the tooth either are very, very forward or very back into the arch, they're going to have more recession because also they have more wear. It's like that gum gets bumped more even when we brush, when we eat. And because, by the position of the tooth being more outside, maybe they're coming outside the bone. So if there's no bone, there's not going to be gum a lot of times. And the grinding, the clenching, and there's a lot of reasons, that can help and contribute also. So that's why we are going to make sure that we recommend you to have a night guard done at your general dentist, and that we control every single potential aspect
Yes.
of what has caused that recession. Another thing that we're looking at before we go into the next question is not only we talked about the height and we talked about the thickness of the gum, but we also look at the quantity of gum. What does it mean that? Well, in the mouth, we have a couple of different kinds of skin. We have the gum. The gum is a type of skin, and the gum actually only is around the teeth. And I don't have a mole. Maybe if you can give me that mole, Mr. Adrian. Yes, thank you. So just in this mole, we can see that we have our teeth and the gums are only around the teeth. But then right after the gums, all the tissue that we have around, in the cheeks of the mouth, in the lips of the mouth, that's called mucosa. And that tissue is very different than the gum. The gum does not stretch. It's not elastic. It's like cardboard. It's like, it doesn't stretch. But the mucosa stretch is like bubble gum. That's why, we can open the mouth, we can, do all the things that we do with our lips, we can, chew, and we don't see any wrinkles inside, right? We don't see the tissue getting wrinkled. It actually expands and contracts like a balloon. And when we are losing the amount of gum tissue and that gum tissue becomes very thin, maybe because the recession has got it into very thin, or maybe we lost all the gum tissue, or maybe we already had very little gum tissue to begin with. That's also can be genetic. So those cases are going to have progressive recession. And then the treatment is going to be different for if we have some gum remaining, or if we have no gum remaining, or how much gum remaining we have. So all those things are going to be considerations that we take into account when deciding what to do, which technique to use, how are we going to fix it, and which kind of technique we want to do, as I mentioned before. So that would be like some of the generalities. Now, if you feel like your teeth that look longer, that your teeth, maybe look yellow in the gum edge, that would be an indication that your gums are receding and you're probably seeing the roots. I think that you need to see your dentist, bring your concern to them, and ask, if you should be seeing a periodontist, or, if you don't have a dentist right now, you can also go and see yourself a periodontist and ask them, do I have gum recession? Is that something that I should address right now? Maybe you do not need surgery right away. Maybe you just need to re-educate on, the brushing technique. Maybe it just needs to be monitored. If the recession is not too bad, if you have enough gum remaining, maybe it just needs to be re-educated, some of the techniques, maybe put you in a night guard, just see like the causes that have produced that recession, address it, and then you monitor it and hopefully never need it.
Yeah. Thank you so much for sharing that with us, Dr. Munné. Just want to appreciate the people who join, Chelsea, Greta, all of you guys might have concerns. We're going to have this every Friday with Dr. Munné, setting up some time for you guys to have some coffee time and then answer questions. Please make sure you leave your comments below, and thank you so much for joining, all of you guys. We see them on Facebook, on TikTok, on Instagram. We're on all the channels. Just go Dr. Anna Munné, DDS, PA, and Associates, and you will have this opportunity to have those questions that nobody has answered in the past, and with all the experience that Dr. Munné has in the industry. So Dr. Munné, would you just tell us briefly, I know you have mentioned a bit about gum grafting and just so many aspects on it, but who do you think is a good candidate for gum grafting?
Well, I think that all patients that have gum recession that don't have sufficient gum to protect their candidates through gum grafting. So very important evaluation will be to see how much remaining gum tissue there is. That's called the keratinized gingiva. So we measure if there's minimal amounts of keratinized gingiva or no keratinized gingiva, which is means the same thing as how much gum is remaining. And then depending on how much gum is remaining, if there's not sufficient to maintain health, then that's a patient, that's a candidate. Or even if there's a little bit of gum, but the recession, a patient that had a lot of gum but had a lot of recession, even if there's a little bit of gum left, there's still going to be a candidate, just to protect the root, make sure that no more bone is lost. And sometimes those teeth can be loose also, so that also can bring some sturdiness and remove the mobility or the looseness of that tooth, especially in the lower teeth. So those are going to be patients that are candidates. And there's many techniques, so I think that that's something that needs to be discussed with your periodontist. What's the best technique for your case? And some techniques have amazing results. So nowadays we have, very, very nice results. And please refer to Healthy Gums for All, our website. We do have cases there. And if you're interested, if you think you have it, we'll be happy to take a look and let you know, which stage you are and what you should do about it.
Thank you so much, Dr. Munné, for your great time. I know she needs to get back into the rest of the day, but thank you so much for tuning in, guys, and all those social platforms. Don't forget to like, comment, and everything. All your questions will be answered and will be addressed. Now, remember that we're in the Gum Grafting Series. It's going to be an exciting series with all of that comments and all of those, doubts that you have had along the road. Thank you so much. Please tune in next Friday in the morning, and we'll see you there.
So the this was in my face the whole time. I didn't move it. Are they gonna see it?
Oh no,
No.
Mama, that's no.
Okay, because I was like this, like in the middle of my eye, like the whole time. I
Whew.
could
Oh
see
my
it, like.
goodness.